you, Mr. Chairman, and Ranking Member Lipinski, and thank the witnesses. Yeah, I'm a physician by training, and I represent Sacramento County, where we've got, in Northern California area, where we've got a huge methamphetamine challenge. You know, the Sacramento Bee reported that 40% of the men arrested in Sacramento County have meth in their system, and just as we think we're making some progress, as Dr. Maxwell showed, those that are supplying, are staying one step ahead of us here. Increasingly, more of the meth that we're seeing does seem to be coming from Mexico and does seem to be being smuggled in as liquid as well. And then I think Sergeant Crawford has talked about the ease of the shake and bake production. So if we focus on the back end, it looks like it's going to be a very difficult challenge for us to get a handle on. On top of that, when I look at our law enforcement, at one time most of our law enforcement agencies had narcotics units. Now a lot of our police departments have lost narcotic units. In Sacramento, the Sacramento PD shuttered their narcotics unit in 2011. So that also adds to the challenge here. We've seen the ability to provide treatment go down. In California, in 2006, we had 78,000 patients admitted to meth addiction programs. Just less than 5 years later, it's less than 44,000. So, I'm not painting a rosy scenario here. This is a challenge. And then concomitant to that, I was chief medical officer for Sacramento County. The number of folks that have dual diagnosis, mental illness and substance abuse, the number of folks that, by not addressing the root cause issues, we end up, building more jails. We end up having to build these back-end solutions. The challenge that drug addiction, not just methamphetamine but cocaine, and now we're seeing a huge uptick in prescription drug abuse, and the impact that has on the family social structure, the impact it has on the foster care system, et cetera. So there's these huge sociologic challenges. I haven't asked a question yet because these are real issues. We've talked a lot about back-end solutions, but if we were to look at the root cause issues and try to shift towards prevention and some of the social science that it potentially leads to drug abuse and addiction, I guess I'd ask Dr. Maxwell, where would you like us to focus if we were to try to focus on front-end solutions and root cause solutions?
Thank you. We've tried a number of different approaches to prevent youngsters from using drugs. There have been some that have been proved to be quite effective, but it seems like we start doing something and then we drop it.
Right.
I really wish we'd go back to some of those prevention programs that have, through the follow-up test, been shown to be effective.
Because it's probably making a commitment over a generation, right? I mean,
Exactly.
So, what would you say some of those programs are that you'd like to see?
They're up on the SAMHSA website, and I can give your staff the links to it, but some very, very, very good ones. So before we start over again, I think it's time to go back and look at which of those are the most effective and could be modified to handle these new drugs.
Dr. Napier.
And to continue that dialogue, there's a couple things. One is we have to understand that the curriculums are regulated by criteria that have to be met. And so for us to come in with a new curriculum adds a huge burden on our already burdened teaching system. So we have to be very sensitive to that. So what I think is a good approach is a more integrated approach, and it needs to be over the course of the student's experience in junior high and high school. It can't be you have a speaker come in and give a talk in the auditorium and leave. It needs to be integrated into health sciences, PE, social sciences, and be science-driven. And I think that's where we have a lot more that we can do to make this better, to where good decision-making is part and parcel to drug prevention. And we all know that the adolescent brain is a different brain than the adult brain, and the capacity to make decisions is not the same. And we all know that the frontal cortex is not developed in children until they're 21 or 23. And so we need to have empirically based curriculum that will reach the adolescent in terms of these decision-making processes based on their neurobiology.
What would you say the right age for intervention is if we were to, elementary school?
Elementary school.
Okay.
Absolutely. And also, I think it's important to think about in urban situations where students drop out of school, you want to reach those children before the dropout rate starts to escalate. So again, that means...
I don't know if Sergeant Crawford or Dr. London.
We're going to do another